It was like night and day. It was pain relieved immediately.
Welcome, I'm Rob Lowe. The quest to find innovative surgical techniques has led to great advances for surgeons. Today, the outcomes of surgical procedures are better than ever, as you're about to see.
85% of all adults will experience incapacitating back pain at some point in their lives. For most of them, the issue will resolve in the short term. But for the others, about 10%, the pain will continue.
Living with back pain really affected my entire life. It affected what I did sport-wise as an athlete. It affected my family. It was not fun at all having low back pain.
When a person experiences pain from chronic disease or injury of their spine, it affects every area of their life. Studies have revealed that a person can actually lose 2/3 of their creative ability when they're in chronic pain. And so back pain, neck pain can affect a person's sleep, which affects their everyday activities, and can often lead to a position of disability in life, which of course affects every sphere of living.
There are many approaches for treating back and neck pain.
A person should always try and exhaust every conservative approach to resolving their back pain, such as chiropractic care and physical therapy, acupuncture, weight loss, those things which a patient should do.
Everybody tries muscle relaxers, medication. I tried aquatherapy. I tried chiropractic. You will try anything when your back hurts so badly.
If the pain persists and surgery is recommended, it is important to understand your options.
This is such an important decision for an individual's health. Everyone should carefully analyze all of the options that are available to them. And it only makes logical sense that the human being would first try the least invasive approaches to resolving their issues, not disturbing the supporting structures of the spine, which would necessitate a fusion. In today's world, there are minimally invasive approaches that are far different than the old open back surgery approaches, which can often lead to disability.
If you have a surgical problem with your back and you have the choices of a decompressive or a minimally invasive type of surgery versus a fusion, I think that if you start with the minimally invasive or non-fusion options, that if things aren't exactly as you like, then you have the choice of a fusion. But if you do a fusion first, you've rolled the dice. There's no further options.
I had a doctor that recommended fusion for me, and I just could not. Knowing what I knew about back surgery and the things that I had heard about back surgery, I wasn't going that route.
Minimally invasive spinal surgery is a developing field that has become mainstream.
The advantages of minimally invasive spine surgery are that there's no overnight hospital stay, the patients are ambulatory, we do not disturb supporting structures of the spine, which does not necessitate the plates and screws of a fusion, and often the patient is back to work within as little as 2 weeks.
Endoscopic spinal surgery, in its current state of affairs, is really like operating through a pen-sized diameter tube with the cameras and everything all directed at the problem. Without any bone removal in most cases, you can access the small pain-generating areas of the spine, usually with one stitch at the most. People return home the same day and are back to work in a pretty quick recovery process.
After I had my surgery, it was like night and day. It was pain relieved immediately.
As modern medicine and healthcare continue to improve, those improvements will be highlighted here. See you next time. I'm Rob Lowe.